Radyo Ronda
DXKP Pagadian.
Member, kapisanan ng mga broadcaster ng Pilipinas.
Thousands of deaths every year, mainly in Asia and in Africa, with children being the most affected. It remains a serious public health threat in the country as well, but it's vaccine preventable. We'll know more about this viral disease on today's episode of MedTalk Health Talk. I'm Dr. Freddy Gomez. Rabies is a deadly virus that can be easily prevented, but not without immediate and appropriate care. To explain more about this topic, we have on the program Dr. Ferdinand de Guzman. He's a family medicine and infectious disease specialist from San Lazaro Hospital. He's also a member of the Asian Rabies Expert Bureau. We're also joined by Dr. Pauline Convocar. She's the president of the Philippine College of Emergency Medicine. Thank you both for being with us. Now, the month of March is Rabies Awareness Month, and an estimated 200 to 250 Filipinos die from rabies every year. Now, dogs are the main source of human rabies deaths. According to the World Health Organization, at least a third of deaths here are children. Dr. Ferdy, I'll start with you first. What causes rabies and why does it remain a serious problem in our country?
Rabies has always been there. It's one of the oldest diseases, and we're aware of what the disease is, but there has not been so much implementation. In fact, there is a law. Okay, this was passed in 2007, but the law has not prevented the cases of rabies, and of course, we have been lax when it comes to responsible pet ownership.
Okay. Now, the Philippines had a goal of becoming a rabies-free country last year. But Dr. Ferdy, why has that not yet been achieved? And what do you think should be the next step?
We have been lax about the implementation about the law. The law actually is very good. It was passed way back in 2007. So if we had followed, if we had seen to it that there would be no stray dogs, okay, because the key to the prevention and reduction of rabies cases is in dog immunization. So if we have a responsible pet ownership on the part of people who own dogs, we would have less cases of rabies.
Rabies is transmitted through bites of an infected animal at ang pinaka-common dito ang mga unimmunized dogs. Now, Dr. Pauline, is there any other way rabies can be transmitted other than a bite? Say, for example, kalmot.
Yeah, it's still very much possible that a kalmot or a scratch may still be able to transmit the virus because you'll never know when the animal just licked its paws or nails and then scratched the patient. So that's one non-bite transmission of the virus. So it is still possible that there may be non-bite. Your pets may inadvertently lick your lips or any mucosa, and that may be a form or a way of transmission of the virus to the patient.
Oh, so there are more than one way to get infected with rabies. But are all dogs born with rabies, Dr. Ferdy?
Okay. Rabies is transmitted, or the carriers of the disease usually are warm-blooded animals. Of course, dogs, cats, they have the potential to transmit the disease. So they develop the disease first and then transmit to humans, whether bite or non-bite. We always say, if you have a dog bite or a cat bite or an exposure, bring the victim to the hospital. But most of the time, the source of the disease or the source of the exposure is there, the pet dog, which is not bite, which I said earlier would be considered as stray.
Dr. Pauline, aside from dogs, meron pa bang ibang mga common animals that our viewers should be aware about that is most likely to transmit rabies if ever they're infected to people?
Yeah, as what was explained by Dr. Ferdy, all warm-blooded mammals, Dr. Ferdy, right? So, but
yes.
However, in the Philippines, 98.5 to as close as 99% really are transmitted by dogs. all other animals that may transmit may be cats or any other domesticated animals that are warm-blooded. So they may still transmit, but they only comprise around less than 2% or 1.5% of the animal bite cases that we have in the Philippines.
Okay, so I can't stress enough the importance of trying to prevent rabies from happening, because by the time you start showing symptoms, it's most likely too late. Now, Dr. Ferdy, could you please explain to us how the virus travels through our body? How fast does this spread?
Okay, the usual scenario is that of a bite. Okay, so the saliva gets inside the human body through a bite, through a break in the skin. Now, the rate of travel of the rhabdovirus inside the body is 2 to 4 millimeters per hour. So actually, it's rather slow if you would count it as per hour. That's why we would say it's an urgency, not an emergency, because actually we still have time to prevent the development of the disease. When we see patients, we often ask, did the wound bleed? Okay, so if the patient or the guardian or caregiver tells us, yes, the patient bled, so it's a higher risk for the development of the disease if exposure is serious. So below the waist, because it's far from the brain, we would say that the wound is minor. Above the waist, because it's nearer the brain, we would say the exposure is major. So of course, with the 2 to 4 millimeters per hour, if it's above the waist, especially head and neck areas, automatic, that's a category 3 exposure, meaning the risk of the patient developing the disease is higher.
Okay, very good. Now, Dr. Pauline, if someone is bitten by a dog na hindi sila sigurado kung immunized ba against rabies ang aso, is this immediate time for them to go to the ER?
Ang payo ko talaga is pumunta ng emergency department if in doubt. Always. At least there, you will be evaluated, you will be assessed if indeed what's the category of the bite. But before doing so, in the house, you may immediately and vigorously wash the wound with soap and water, preferably for around 10 to 15 minutes. If not available, the wound may just be thoroughly washed with water, but you may also apply antiseptic like alcohol or ethanol, 70%, and then proceed immediately to the emergency department should you have doubts if the bite was from an unimmunized dog or an immunized dog. Regardless, you should visit the emergency department.
Dr. Pauline, is it important for the emergency room physician na alamin nila yung status ng aso na kumagat doon sa tao?
Yes, we have to also know the status of the dog, even the status of the immunization of the dog. But more likely, oftentimes, the dogs are stray, or if they're not immunized, or when in doubt, we really treat them as unimmunized. Besides, even if the dog is immunized, we still give the necessary prophylactic vaccination, regardless of the vaccine status of the dog. Then we have to evaluate again if the immunization status is valid or not expired. So that's how we evaluate the wound first, and then evaluate also the immunization status of the dog.
Okay, so the first symptoms of rabies in humans may be very similar to the flu and may last for days. More on this when we come back. You're watching MedTalk Health Talk on CNN Philippines. Stay with us. Is rabies, which remains a serious public health threat in our country. Before we proceed with our discussion, let me emphasize the legal responsibility of pet owners in our country. Under Republic Act 9482, otherwise known as the Anti-Rabies Act of 2007, pet owners are required to have their dogs regularly vaccinated against rabies and maintain a registration card which contains all vaccinations conducted on their dog. For accurate record purposes, submit dogs for mandatory registration. And maintain control over their dog and not allow it to roam the streets or any public place without a leash. As what Dr. Ferdy mentioned, any dog without a leash is a stray dog. Rabies in humans progresses in 5 stages: the incubation, prodrome, acute, neurologic period, coma, and then death. The incubation period is the time before symptoms may appear. Dr. Ferdy, what happens during this stage and how long does it usually last?
Most of the time, these cases are misdiagnosed at the start because when they pass through the first stages which you mentioned, there is no hydrophobia yet, no aerophobia. This only become obvious a few hours prior to admission. Weakness of both extremities. But it's just good that the clinician who saw the patient managed to elicit a history of bite. Okay? So it doesn't have to pass through the different stages. What makes it obviously a case of rabies is when the symptoms of hydrophobia and aerophobia appear. And that is what we usually see in the emergency room or in the homes of the patients where these symptoms are first manifested.
Napaka-importante talaga ang time frame in bringing the person to seek medical care kaagad. Dr. Pauline, Dr. Ferdy mentioned about hydrophobia or yung fear ng water, ayaw uminom ng tubig, o yung aerophobia. Bakit kaya nangyayari ito sa isang taong infected with rabies?
If you understand, encephalitis kasi siya so talagang merong changes in behavior siya. They may not follow the same order, and oftentimes we see patients at the later phase na sila pumupunta. Ang payo ko talaga is that early on, with the history of bite, just visit any emergency department so that your wounds may be evaluated and we will already know if indeed you already have human rabies or not.
The drooling and the fear of drinking water is actually the pain that manifests. They feel a lot of pain whenever they do that. Now, Dr. Pauline, could you please explain to our viewers what is a step-by-step? What can they expect to happen?
So if we have here an emergency department, you'll go through a triaging process where the patient gets to be categorized based on severity and acuity, if the patient can wait or if the patient can't wait, and will be managed accordingly because that also depends on the phase of the PHASE of the presentation, if indeed you have already rabies or not. But if this is just an animal bite, then you'll be triaged according to an area where you will be registered, and then of course a doctor and a nurse will attend to you, evaluate the wound, and you'll be put in an area where the wounds will be evaluated. If you have not yet done the washing of the wounds with soap and water, it will be done again in the emergency department, and medications will be given depending on the assessment.
If a dog bites a person, it's necessary to keep the dog isolated from other animals and people for at least 10 days and observe it for abnormal or rabies-like behavior. Remember that rabies is a medical urgency. Now, Dr. Ferdy, what should someone do if they are far from medical help?
Actually, that's a very big problem. You are far from a facility that handles bites or that treats animal bites. These are actually things not to do in addition to what Ma'am Pauline has mentioned. Oftentimes in areas outside Manila, they think that dog bite is a snake bite. So what they do is they tie it with a very tight tourniquet, very tight, rope. They would say that this is to stop the upward spread, the spread of the virus inside the body, but actually this is wrong. You're cutting off the blood supply from in that part of the body, maybe let's say the lower extremity where the child was bitten. Applications of concoctions. So while waiting for transportation to bring the patient to a facility which handles bites, please do not apply bawang. Many times we still see nowadays, they scrub bawang over the affected area, and what happens, it burns. Nasusunog po ang bite site. So it increases the size of the injury, as what Ma'am Pauline mentioned. So there's the risk of the patient developing tetanus, Another thing also, because you mentioned that a patient or the incident might have happened in an area where the nearest facility is 3 to 4 days away if you walk, if it's in the mountains. What we would often say is that observe the dog, take care of the biting animal, because most of the time the biting animal is a big help. When they finally get to see a doctor, first question we would often ask is, buhay pa ang aso? Nakikita niyo pa po ba ang pusa? As long as biting animal is alive, it's safe. Wala pong rabies ang biting animal because there are still no signs and symptoms of rabies in the dog.
So napaka-importante talaga yung condition ng animal, especially if you're far from adequate health care, because the status of the dog will give you an insight if this animal does have rabies or not. Because rabies is a potentially fatal condition which is 100% preventable when immediate medical treatment is received. It's important to know that the health department provides free anti-rabies vaccine for post and pre-exposure prophylaxis in all animal bite treatment centers. PhilHealth, meanwhile, provides qualified members a package that helps pay for the cost of post-exposure treatment. When we return, more on treatment for people who were bitten by animals with rabies. Your health is our priority here on MedTalk Health Talk. The World Health Organization has a global campaign to end human rabies death by 2030. Here in the Philippines, we had a campaign to end rabies in 2020, but that has not been achieved. Our knowledge and understanding of rabies can help protect you and your loved ones from this potentially deadly viral disease. Welcome back to MedTalk Health Talk, your connection to healthcare. All suspected cases of rabies should be treated immediately to prevent the onset of symptoms and death. Dr. Pauline, can you explain the treatment process?
So, okay, upon assessment of the wound, so that depends on the category of the wound, then perhaps a post-exposure prophylaxis, the vaccine may then be indicated. There are two types of how to give the vaccine. It may be through intradermal or intramuscular. There's a regimen to be followed strictly on schedule. So if the category is 3, then we have to give both passive and active vaccinations. So we have to give an immunoglobulin for the category 3 types of bites, and of course the prophylactic anti-rabies vaccine for all types of categories of the wound.
Oh yes, that's a follow-up question. Dr. Pauline, can you only get vaccinated after getting bitten or scratched by a dog?
Actually, you may prefer to have yourself vaccinated if you are high risk. Say, for example, you are a zookeeper, you are a veterinarian, you are a veterinarian assistant, or you are a lab technician or a lab personnel that has this high risk of exposure to a potential reservoir of rabies, then you may opt to be given a pre-exposure prophylaxis or a vaccine.
Not all animal bites require preventive rabies interventions though, but medical attention should be immediately sought after if the bite is from an animal exhibiting signs of rabies. Wildlife are much more likely to be rabid than domestic animals, but your pets can be infected when bitten by rabid wild animals, especially stray dogs, as what Dr. Ferdy mentioned earlier. Dr. Ferdy, why should we vaccinate our pets and how often should they get vaccinated?
So if you immunize dogs, because prevention would be cheaper, okay, and of course less traumatic to our patients, okay. If it's category 3 and it's a new patient, okay, no pre-exposure immunization on the part of the patient, like what you mentioned or like what was discussed earlier, and if dog is not immunized, marami pong injection. Because remember, you're not only preventing rabies, you have to prevent tetanus.
Now, knowing where to go after getting bitten by an animal is essential information to avoid complications. And an animal bite center is a facility where you can avail of services about animal bites. Dr. Pauline, where can people or our viewers go to in order to find out yung mga animal bite centers natin dito sa bansa?
There are two kinds of animal bite hospitals where you can go to. An animal bite treatment center are mostly government hospitals, but there are also private animal bite centers that can also attend to patients with animal bites. So you can conspicuously really see these signs because they are mandated also by accrediting bodies that they should have conspicuous signs that may lead you to these areas where you can have your wounds managed.
And we wrap another interesting episode today. We'd like to thank our guests, infectious disease specialist Dr. Ferdinand de Guzman and emergency medicine specialist Dr. Pauline Convocar. We appreciate your time and effort. Education is key to rabies prevention. Teaching people, especially children, about rabies is crucial to prevent this lethal disease. It may be fatal, but it's 100% preventable when you know what to do. I'm Dr. Freddy Gomez, helping build a healthier future for you. Thank you for watching.